Let's talk about the so-called brain-eating amoeba, Naegleria fowleri, what it is, how it harms, and what actually lowers your risk. First, the path in. It doesn't come from drinking water, it infects when contaminated warm fresh water goes up the nose, lakes, rivers, hot springs, poorly maintained pools, splash pads. From the nose, it rides the olfactory nerve, straight into the brain. Now the clock starts. Day 0 to 1, exposure, you probably feel nothing. Day 1 to 7, early symptoms look like classic meningitis, fever, headache, nausea, vomiting, stiff neck, light sensitivity. This is primary amoebic meningoencephalitis, PAM for short. It's rare but it moves fast. What's happening inside? The amoeba reaches the olfactory bulbs. The brain's smell centers and begins destroying tissue. Your immune system fights back hard. That battle, plus the amoeba's own enzymes, causes inflammation and swelling. The skull can't expand, so pressure rises. Nerves are squeezed. Blood flow gets disrupted. Day 2 to 5 after symptoms. Things escalate. Confusion, behavior changes, severe headache, neck stiffness, loss of balance, seizures. Olfactory damage can mean loss of smell. Pressure on brain structures triggers vomiting and intense photophobia. Without rapid, aggressive treatment, swelling worsens. That's why many cases progress to coma. Death usually happens about a week after symptoms begin, mainly from massive brain swelling and widespread damage. Not just from the amoeba, but from the immune response amplifying the injury. This sounds terrifying, so context matters. PAM is extremely rare compared to the countless freshwater swims every year. But rare doesn't mean impossible, and prevention is simple. In warm freshwater, especially during hot weather, avoid getting water up your nose. Keep your head above water, or use nose clips. Don't stir up sediment in shallow, warm areas where the amoeba can thrive. Properly chlorinated pools are lower risk. Maintenance matters. Splash pads are lower risk when properly maintained. For neti pots or sinus rinses, only use distilled or sterile water, or water that's been boiled for 1 minute and cooled. Tap water straight from the faucet is not sterile. Spotting it early matters. If you or someone you know develops sudden meningitis-like symptoms after recent warm freshwater exposure, fever, severe headache, stiff neck, vomiting, seek emergency care and mention the exposure. Doctors may use a combination of anti-amoebic drugs, antifungals, antibiotics, and measures to reduce brain swelling. Survival is rare, but possible with very fast treatment. Final takeaway, the risk is low, the timeline is fast, and small habits go a long way. Nose protection, good water hygiene, sterile nasal rinses. Enjoy the water, but keep it out of your nose.